In our over 35 years of experience treating cancer patients, it became obvious to us there is a significant influence of the patient's nutritional habits, both in the past and during cancer treatment, on their chances of cure, on their tolerance to treatment, and on how they survive after cancer treatment is finished.
20 to 40% of cancer-related deaths are due to causes related to malnutrition rather than to cancer itself. If the dietitian is able to provide nutrition intervention early on, we're able to prevent or at least slow down the rate of weight loss so that the patients can get through their treatments without interruption.
If you're healthy, you're going to be able to tolerate anything better than if you're chronically ill, where the body's immune system may be suppressed, may not be able to handle the stress of surgery. Nutrition is a critical component of that because it sets the stage for your body to be able to go on and tolerate this therapy that's important for you to get over your cancer.
The idea came out of our team to create a program called Eat Healthy, Shop Smart to Fight Against Cancer. The administration of Montefiore Medical Center decided to open a farmer's market and have fresh natural foods available to all the patients in our community.
We have a group of patients that meets and we tour the food vendors. I introduce them to foods they've never seen before, never tasted before, and I'm able to give them specific individualized instructions on specific foods that they should try. I'll buy you the eggplant, just taste it. If you don't like it, you haven't lost anything.
Well, I first heard about the program when I was going through my radiation treatment. I did not eat healthy. Coming to the farmer's market, I got involved with some of the other vegetables that I ended up liking that I didn't know anything about. I was surprised that I was able to change my habits.
The environment is very casual, very friendly. They're open to telling me what they're really afraid to ask inside the clinical setting, and they really enjoy to be around each other. They're able to see someone else succeed through their treatment and do well, and that's very empowering and encouraging for them.
They are doing something very different than passively taking medications, diet pills, chemotherapy, radiation, and so on. They feel actively engaged in the promotion of their own cure for cancer and in promoting their own health for the future, so they love it.
It's completely unreasonable to think that you can cure cancer or even treat cancer without the best conventional medicines. It's also unreasonable to think that you can't rely on the body's natural ability to protect itself against tumors and on nature's ability to provide the body with the nutrition and the strength that it needs to make its immune system strong enough to fight off disease.
The complexities of a cancer center are immense. There is no cancer treatment that is performed by one specialty. Multidisciplinary, coordinated care is key.
The patient gets to see everyone under the same roof at the same time and gets managed for different symptoms and different issues.
And they feel much more comfortable when they know one doctor's talking to another doctor. They can always have access to the doctors. They can have access to the nurse. There's a whole team of people who are working just for that patient.
I actually do feel like I'm part of a Monty family because everybody worked together and gave me support. They also gave my family support.
In the winter months when it's too cold to be outside with these patients, we have the cooking classes. They've learned how to choose an organic eggplant at its peak ripeness. They've learned how to tell the difference between escarole and Swiss chard. Now what? We give them suggestions for recipes. We tell them how to cook it. We tell them how to incorporate it into a plant-based diet. So they can do these things confidently when they're by themselves. It's very important for the dietitian to be culturally sensitive. If we don't have an understanding of the ingredients that they use, the methods of preparation that they're used to, the staple foods in their diet, we can provide them with nothing more than basic nutrition education that they couldn't apply. I'm most proud when I see my patients encouraging each other to try new foods, to try to eat better, and to do it so passionately. I'm able to sit back and say, I was able to spread my excitement about nutrition to someone else. I want patients to walk away with the confidence to take responsibility for their own nutritional status. They can decide what they can eat. They can decide how they prepare their foods. They can decide where they get their foods because they know that they have the support from the Nutritional Oncology program at Montefiore behind them.
My life has changed, and it's changed so much for the better. I'll live a longer life because I'm taking care of myself.